Hundreds of black, Asian and minority ethnic doctors still haven't had coronavirus risk assessments. Their risk reviews haven't been acted upon to keep them safe at work. That's according to the latest BBC research. The British Medical Association, which represents doctors in the UK, is calling on the government to renew its commitment to protect ethnic minority doctors. Well, in a moment, I'm going to be speaking to a junior doctor, Temi Olonisaki. But first to our reporter, Amara Sophia Elahi, who was looking at this for the BBC. And Amara, first of all, give us the background to this.
Well, Simon, there's no doubt that Black, Asian and minority ethnic communities have been particularly hard hit by coronavirus. Studies show that they're more likely to get the virus and become seriously unwell or die from it. And there are a variety of reasons why that might be. For example, certain health conditions that are more prevalent within particular communities, certain occupations that increase people's exposure. And even according to a Public Health England report from last year, racism or social inequalities. Now, if we look at the figures for the number of doctors who've died from coronavirus, the British Medical Association has recorded 44 deaths. And of those, 90% have come from ethnic minority backgrounds. So it was in response to this that NHS England, as well as the healthcare systems in Scotland, Wales and Northern Ireland, issued guidance to hospital trusts and clinical commissioning groups last year, asking them to carry out risk assessments for non-white staff in particular. And these risk reviews were a way of trying to protect healthcare workers by looking at certain factors such as age, ethnicity, underlying health conditions, and calculating an individual's risk based on that. So if doctors were found to be at high risk, protections could be put into place for them. For example, higher grade personal protective equipment, or they could be redeployed off frontline duties.
And what did the research find specifically?
So in January, BBC News sent a questionnaire out to ethnic minority doctors via medical associations across the UK, and over 2,000 doctors responded to our questions. One of the issues that we asked about was risk assessments and their outcomes, and of the doctors who responded to us, over 850 said that their risks either hadn't been assessed or that they had, but no action had been taken as a result. We also asked about the mental health impact of working during the pandemic. And unsurprisingly, 1,600 doctors told us that they had experienced some kind of psychological impact during this time. Another issue that the research looked at was bullying and discrimination, because doctors had shared accounts with us during the pandemic about being treated differently to their white colleagues. Some said work was disproportionately allocated to them in areas where there was more exposure to coronavirus, and others spoke to us about feeling that their concerns weren't often listened to. So of the doctors who took part in our research, over 700 said that they had felt discriminated against by colleagues and managers during the pandemic, and another 700 said they felt bullied during this time.
And what did the Department of Health say?
Well, NHS England say that 95% of staff from ethnic minority backgrounds have had a risk assessment and vulnerable staff have been protected. They also add that every employer is required to support workers who raise discrimination issues. And this has been echoed by the healthcare systems in Scotland, Wales and Northern Ireland.
OK, Mara, thank you very much for that. Let's talk now to Dr. Temi Olonisaki, and you're a junior doctor. I'm just wondering how many risk assessments you've actually done as a member of staff.
Thank you for having me. So I have had 3 risk assessments done. One was done at the beginning of the pandemic in March, and the other 2 were done, one in the summer and one in autumn.
And I think you had one in March, and it was agreed you wouldn't do patient-facing work. What happened after that?
So after that, because I'm a foundation year doctor, I switched hospitals and switched rotations. Obviously in the summer, the pandemic was less of a burden on the NHS and we were seeing less COVID patients. So after my risk assessment, it was deemed that I would be placed on a ward that had a lower risk, which was fine until the second peak in October, where every ward had many COVID patients. So it wasn't really feasible for me to stay on a ward that was deemed as low risk because they were all high risk at that point. And so I feel like the onus was really on me to go and ask for another risk assessment to explain that I no longer felt safe working on the wards that I was working on. And I repeated the risk assessment, and because the ward was now deemed as high risk, eventually I was placed to non-patient facing roles.
Given what you must have seen in your time in the wards, looking at patients, and presumably some colleagues too with COVID, does a risk assessment do it, if you like? Is that enough?
I don't think that a risk assessment, which was just one A4 side sheet of paper, does enough to protect Black and other ethnic minority staff, and also staff with underlying health conditions. I myself have both, so I felt that I had to really push for my safety, but I think that a lot more needs to be done. We need to look at why Black staff members and Black people in general, as well as other ethnic minorities, are contracting COVID more, and when they are, why they are experiencing more complications. I think that the Public Health England report last year made it very clear that things such as racism are coming into play, and the NHS really needs to take a look at why these things are happening and what we can do to prevent it, which would be more than just a risk assessment.
Yeah, no, I wanted to pick up on that, because I just wondered about your colleagues, your white colleagues too. I mean, do they take this as seriously as obviously they should? We hope that they do.
Well, I think that they take COVID just as seriously. I mean, everyone is obviously very aware of the effects. We as healthcare providers, we see the effects of COVID, how rapidly a person can deteriorate. So I think everyone does take it seriously. I can't speak for my white colleagues when it comes to how necessarily worried they are, because they don't have that risk factor of being a different ethnicity.
What actual measures have been put in place to protect those more vulnerable like you?
So I think that every person's circumstance is different. I was quite persistent that I needed to be placed in somewhere that was safe, and at that time the best thing was that I was able to fulfill roles that didn't involve seeing the patients. Some people are able to be moved onto wards that have no COVID patients, but I think it very much depends on your seniors, the staffing levels. There are many different factors which will determine whether you're redeployed or not.
Well, Dr. Temi Olonisaki, it's very good of you to give us your time this afternoon, and thank you too for your work. Thank you for joining us.